Hello viewers, my name is Ruben Ruplal. I'm attached to the Guyana Chronicle. Today we'll be dealing with mental health and well-being, and our guest will be Tull. He's a clinical psychotherapist, consultant, and life coach. Mr. Tull, good morning. How are you?
Good morning. How are you? My name is Shane Tull. I'm a clinical psychotherapist. I've been in practice for more than 25 years. I have worked with the CDC and USAID in Guyana through with the PUSH program at Davis Memorial and Mercy Hospitals. I've been in a I've been consulting in the capacity of mental health expert and trainer in both programs. I also work with APC, that's also attached to the USAID program in Guyana. I've been coming to Guyana for the last 4 years every month, im- implementing skill sets and programs. And I've also been able to see patients while I've been there. So it's been a rewarding experience. And I think Guyana have done a really good job on mental health. Um, I do think that there's lots more work to be done, but I do believe that they're very aware, or they're beginning to be aware of what mental health is. I think in this capacity of COVID, mental health is really been at the forefront, not just in Guyana but throughout the world. I think being locked up in a concentrated area for more than 3 4 months and not being able to go out just freely, having to social distance, having to wear a mask, and really take stock of our lives have really been anxiety provoking for a lot of people and for the world at large. Also, at this point, almost 6 months later, where the pandemic, we're not clear where it's going and how it's going to be arrested. I know today two drug companies came out and say that there are some therapeutics that will be helpful, and hopefully those will be distributed soon. But in lieu of that, 6 months later, we have this phenomenon called pandemic fatigue, where you've been asking people to stay home, asking them to really change their lives, and within that 6 months, clinically, I've seen a lot of depression, escalated anxiety, more definitely more drug use, and this is just across the board. But I really think in pertaining to Guyana, I could just imagine what this kind of stress has caused on families and institutions. Because think of a mother that is home with 3 children, working from home, trying to homeschool the kids and manage all of their anxieties. And if you look at poverty, if people do not have access to food and their basic care, this pandemic have really compounded those needs. And I think those are things from a public health perspective that we should be looking at, and how do we support the vulnerable and the shut in, and what supports that we can afford them.
Okay, Mr. Tull, that is an important perspective on the opinion where COVID-19 is concerned. Additionally, what are some of the coping mechanisms persons can utilize during this period so they can have a better understanding of how to cope, and what are some of the things that they should avoid during this pandemic?
I think some good coping skills really be having conversations with your younger children, having conversations with other family member. I think the advent of social media, where you can have Zoom family meetings and Zoom gatherings, and on other forms of social media, I think that has also been helpful. But really being able to reach out to someone, reach out to your neighbor, having conversations about how you're feeling, really talking to children about how they are experiencing this, and things that you can do to make their lives as normal as possible. Maybe taking them to the park, taking them to the zoo, planning outdoor activities with family. Probably on Sunday afternoon, you can go for a walk on the seawalls, or pack a picnic basket and go to the gardens. Those are things we can do have a sense of normalcy. But I believe really being aware of what people's stress levels are and being willing to reach out and lend support. If your neighbor has 3 kids and you're taking your kids for a walk, maybe you can offer to take them for a walk as well. And just little things that we can do. I really think that what the pandemic has caused us in terms of not being able to do all the things we want to do, I think so it can also be an inflection point where we get to reconnect with ourselves as humans and reconnect to people in our families and communities. Because for some people, they enjoy staying home and spending time with their families. So I really think it's a collective effort. Families and communities need to be involved in how can we make each other's lives more supportive and being conscious of the fact that I wearing a mask shows respect for your well-being as well. I'm protecting myself.
And Mr. Toll, what are some of the impacts pertaining to COVID and depression and suicidal tendencies since persons might feel stifled currently?
It's an alarming impact because people are not able to move around freely. The advent of the pandemic has escalated everyone's stress level, and if you were stressed before, this only intensified. So we've seen an uptake in drug use, alcoholism, uptake in domestic violence, which is a major concern in Guyana in terms of domestic violence. We've also seen just people really having a hard time dealing with their life situation. People are committing suicide more. People are engaging in unhealthy behaviors that will contribute to their depression. So, and generally, I think everyone is experiencing a level of generalized anxiety. Just the fact that we have no idea when the pandemic will be over, and also depends on public policies. What are the experts in your particular region or areas doing to inform public policies? Are they encouraging wearing masks, washing hands, social distancing, and how do you support kids, especially taking them to the park and maintaining social distancing, or sending them back to school and maintaining social distancing? So it, once again, it becomes a community and effort to encourage people to do the right thing, and also being conscious that 6 months later, people are completely frustrated. They don't want to wear masks anymore. They don't want to social distance. But really realizing that those are normal human reactions to any crisis, that after such a long time, they are going to get tired. But as public health policies need to encourage that, need to encourage the usage of masks and washing hands, and really people supporting each other and promoting a sense that we're all in this together and we will get out of it together. And the more we work together, the easier the pandemic crisis will be. And we're able to thrive and come out on the other side much better people as individuals, but also as members of society.
And Mr. Toll, what is your perspective on the issue of persons using drugs, soft and hard, in their coping mechanism and their way of dealing with various frustrations?
Well, I think because of the pandemic, people that have a history of using drugs are already struggling. But within this new environment where they're being restricted and the level of support that they would normally have, because if you're in AA or NA, you can go to meetings where you are meeting with your peers and being able to have that support. With COVID, we can't do that. But there have also been some meetings that have been done on Zoom and so on, which does help support. But I think there is nothing more important than that individual and that collective group process that helps people to support each other. So lacking of that, people will fall back into using drugs or using even more drugs because they're locked in, they can't come out. So what they do things to self-medicate.
Additionally, Mr. Tull, what are some of the aspects of advice that you could share with the authorities in dealing with the vulnerable population within our society?
Um, I think it's important to reach out to to people that are vulnerable, whether they are children, elderly, people that are in recovery, people that are part of the marginalized society. Those are people that are we should be reaching out to and maintaining that we are encouraging them to take proper precautions, to follow public health policies, but but it's also important to forge a partnership with them, saying that we are in this together. How can we help you? What are things that we can assist you with, and really engaging them in the conversation because they are the experts in their lives, and people are very clear about telling you what their needs are when asked.
What are some of the other ideas that you would like to share with our viewers pertaining to their mental health and well being, Mr. Toller?
I would share that be vigilant about how you feel. Be 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 understanding about that this is a pandemic that we're all going through. Pick up the phone, call someone, send someone a text. The people in your lives that you believe are strong and is not being affected by this, reach out to those people because I think when we act strong and people lean on us, but those people are not getting the support that they may need as well. But important to reach out to a neighbor, reach out to the elderly, go by and sit with them, even if they're you're on the stairs and they're inside and you're able to have a conversation. That is what's going to make us get through this together. We have to look at this as a collective effort where we're taking care of ourselves, but we're also taking care of each other. I think this should be the humanity of the pandemic is really how we take care of each other, and that should be a national mantra.
Thank you, Mr. Toll. In conclusion, is there any other aspect of information that you would like to present to our viewers pertaining to your understanding of the current situation?
I would like to encourage viewers to be patient with themselves, be patient with each other, and do their very best to support each other during this process. Because we have no idea how longer this will take. So it would really call upon our humanity to really be able to connect with ourselves, we connect with our family, connect with our community, and really challenge ourselves to be of service. Because when we believe things are challenging for us, there are other people that are in more dire straits. And if we can just step out of ourselves and look for people and places where we can go and contribute our time or take some food, whatever little you can do to enhance the lives of other people, I think it's just as basic as that because we're all stressed and we all need some kind of support and release and just pay attention to people that are close to you if you're seeing vast changes in them if they're normally engaged and they're no longer engaged and they're like not coming to work in time and you've seen anything that's outside of the norm of what their behavior, reach out and ask them, what's going on. I notice these things are happening. Is there anything we can do to support you? And really get involved because I believe people think, asking people, but mental health is a bad thing and you're being rude or intrusive. But that one question, are you okay? How can I help you? How can I support you? Would really allow that person to open up and tell you what their needs are.
Mr. Toll, I would like to thank you very much for sharing your perspectives and opinions with the Guyana Chronicle, and you will obviously be invited again to educate society on the ways and the rightful paths to take. Thank you very much, and do have a blessed rest of the day.